How to teach body image using Shape America's health skills. Hi, Janelle here, founder of Project Wellness, and your go-to partner for all things related to health education. And we are wrapping up this body image video series with teaching ideas for how you can connect your body image unit to each of the health skills outlined in Shape America's National Health Education Standard. But before we dive into the teaching ideas, let's pause for a moment and really think about what is the purpose of teaching body image. So if we are thinking about body image from a skills-based health point of view, the goal of a body image unit is to help students build awareness of what does their relationship with their body actually look like, build understanding of what are the different components of their body image, and helping equip them with the confidence, the knowledge, and skills so that they can live on that at-peace end of the body image continuum. So let's dive in and look at how we can teach students about body image and really help them live at that at-peace end of the body image continuum. So I'm actually going to start with standard number 7. And I like to start with standard number 7 because this idea of self-management, I really believe that each of the other skills are the pillars that empower a person to manage their well-being and to practice those health-enhancing behaviors. So when we're talking about body image and we're really helping to inspire students to care for their body image, we want to make sure the students have a clear standard that they are working off of. By that I mean that we don't want them to believe that having good body image is liking the way you look, because that's not what it is. Having good body image is about being at peace with your body. And I explore that more in the video about the body image continuum. And that to me is really vital for teaching students how to care for the relationship that they have with their body. So if we look at the skill cues for self-management, the pause, reflect, and act, we can use the body image continuum. So we want students to pause and create space to think about what is their relationship. And then when they reflect, they can use the body image continuum to reflect on the relationship that they have with their body, and then they can make an intentional choice and act after. So that is an idea of how you can really intentionally teach the skill of self-management, standard number 7, of using a combination of the self-management skill cues and the body image continuum. All right, so after we've talked about the idea that self-management is the overarching skill and all of the other skills support our ability to self-manage, let's look at standard number 1, which is all about building and applying functional knowledge. So I just want to identify what I believe are the key pieces of functional knowledge that students need to know to be able to navigate their own body image and the relationship that they have with their body. So key things is 1, what is body image? What are the 4 components of body image? That is absolutely vital information that they need to understand. 2, the body image continuum, being able to use that tool that they can really see, what is an enriching and what is a harmful relationship with your body actually look like. The 3rd piece of information that I think is vital for students to know is understanding what is the difference between cultural beauty standards and authentic health metrics. And then the last thing I would say is really understanding what is the difference between body neutrality and body positivity, and really understanding how body neutrality is the key to having an enriching relationship with your body. So those are 4 pieces of functional knowledge that I highly recommend promoting and teaching to your students. If you want to look at how you can start doing that in your classroom, check out the body image video series and Project Wellness's body image curriculum. All right, standard number 2 is analyzing influences. And this is probably a skill you are already connecting with body image, but what we want to do here is we can use the SCAN skill cues, which is part of Project Wellness's health skills toolkit, and help students really define, hey, what are the things in my life that make me feel at peace with my body? What are the things in life that make me feel at war with my body? We also want to help students build a deep awareness of, hey, what are the actual influences in my life that are impacting my relationship with my body? Taking time to really identify what are the cultural perceptions around bodies, what are the conversations we hear about bodies. All of these different areas of reflection are really going to help students understand what's actually going on with the relationship they have with their body and what are the things that are influencing it. Another possible teaching idea is having an influence report card. So having students really think about their relationship in their own life, having them identify who are the influences, and then rating those influences as yes, helping me live at peace with my body, or thumbs down, causing me to be at war with my body. So standard number 3 is all about accessing resources, which there's kind of 2 strands to this. There's the accessing information and there's accessing services. So when it comes to information that can be accessed, of course, we can look at Project Wellness's skill cues for accessing information, like the Prove It method. So we could actually build on one of those pieces of functional knowledge, the comparing cultural beauty standards and health metrics, and that could be an exploration for students of looking at what actually are authentic health standards, having them compare the difference between cultural beauty standards and authentic health metrics. They can use the Prove It skill cues to navigate accessing valid and reliable information. Also, talking about body image, there could also be conversations about dieting, conversations about different exercise fads, those different things. Again, we can use the Prove It skill cues to see, hey, are these valid practices? Are these practices that are actually going to enrich my body, enrich the relationship I have with my body, and enrich how I care for my body? In terms of services, if you are wanting to talk about what a toxic relationship with the body looks like, maybe looking at something like body dysmorphia, you can actually show students where, who, and where to access different services. They could go through the steps of practicing accessing those services as well. Okay, standard number 4 is interpersonal communication. So there are so many ways that interpersonal communication skills come into every unit, and often a lot of it is just in terms of the discussion and the conversation that you're having with students. But more specifically, if we think about when it comes to caring for body image and caring for the relationship with our body, what communication skills do we need? So I think that kind of a different way to think about this skill is the self-talk piece. Now, we often think about communication skills and talking to other people, but when it comes to the relationship we have with our body, the communication that we have with ourselves, the self-talk is so powerful. And shifting the way that we talk about our bodies to ourselves and to other people is from a body negative or a body positive point of view to a body neutral point of view is incredibly empowering and liberating. If you want to explore the difference between body neutrality and body positivity, check out this other video that I have, and that could really be it could be a really interesting experience for students in terms of the self-talk that they have. Another thing in connection to interpersonal communication skills can be in terms of if a student is really feeling like that they're at war with their body and that the relationship they have with their body is very toxic or complicated and harming their well-being, they could practice and build some self-advocacy skills and scripts to be able to seek help and seek services and just support in terms of the relationship they have with their body. And the 5th standard is decision making. So decision making, there's ways we can incorporate this with the other skills as well, like something like analyzing influences. And once students have determined if an influence is positive or negative, and then they can make a choice based on that. So that's part of it, is decision making as well. And whatever we do with decision making, we want it to be really authentic, and we want it to be quick and easy for students. So not something like the DECIDE model, which I'm guilty of using, and we're replacing that in the Project Wellness curriculum with updated skill cues, but really wanting students just to be able to have a quick reflection about what different decisions are. So just even having students come up with a question that they're going to ask themselves when they encounter decisions in their life that are going to potentially could impact the relationship they have with their body. So just maybe getting them to write a question, and that prompt they ask themselves might be something like, and is this decision moving me towards the at peace or the at war end of the body image continuum? Another idea is that maybe connecting the skill of decision making and the topic of body image is less about future decisions and more about reflecting of, what decisions have gotten me to this point that I'm at right now? Like, what decisions have gotten me to this moment and where I am at this moment on the body image continuum? So there's definitely different options. I do think that to teach decision making in a really authentic and empowering way with body image, it does require us and our students going to this deeper level. It's not a superficial conversation. It's real, it's hard work to really consider, like, how did I get to this point? How did I get to this point of being at this, this specific spot on the body image continuum? And what have I done to get here? If I want to change it, how do I change it? If I want to stay, how do I stay? It's definitely a thoughtful and mindful experience that students are going to have to buy into it for it to be a truly impactful learning experience. So standard number 6 is all about goal setting. Now, again, the purpose of our body image unit is all about how can we get students to be at peace with their body, not how can we get them to like the way their body looks or how to get their body to look a certain way, but really how can we get them to feel at peace with their body, to not be at war with their body, how do we get them to embody body neutrality. So when we integrate goal setting into a conversation about body image, we want to make sure that it's always focused on that relationship of how do we get to this point of being at peace with our body, not how do we like the way our body looks or how do we change our body so it looks a certain way. It's all about how do I get to this point of feeling at peace with my body and that relationship that I have with my body being at peace. So we can give students some tight parameters to write a health goal. So maybe that health goal is about, okay, what type of, and we can connect it to other skills. So maybe we connect it to something like interpersonal communication skills. And it's like, what type or what self-talk scripts can I tell myself when I'm feeling at war with my body? And then build a goal based on those very specific self-talk scripts. Or maybe it's a goal of connecting to influences, and it's, okay, when I'm scrolling on social media and I see something that makes me feel bad about my body, what am I going to do? Am I going to block the person? Am I going to unfollow? Am I going to put my phone away? Am I going to focus on something else? So then the skill is about when I encounter an influence that is harming the relationship I have with my body, what am I going to do? And the goal is all about what am I going to do? So those are some ideas of how you can bring goal setting in to a body image unit that is very empowering. It doesn't have to be something excessive. It doesn't have to be something, really big. It's really just about what little changes of behavior that can I make that is going to positively enrich my well-being and move or keep me on that at peace end of the body image continuum. All right, I already talked about standard number 7, so let's go to that last standard number 8, advocacy. And when it comes to advocacy, we advocate for ourselves and we can also advocate for others. And there's lots of different layers to being able to advocate. And again, it's all of these skills and the functional knowledge, they build upon each other, right? Because ideally, students have a deep understanding of what their relationship with their body actually looks like. They understand what body neutrality is. They understand what authentic health metrics are. And when they understand those things specifically, when they understand what the relationship with their body looks like, and they start building a framework for what they ideally want it to be, then they can start really advocating for their needs. They can practice the Project Wellness skill cues like ask for advocating for yourself. So A, assess your needs, S, speak up, and then K, keep advocating. So if there is something going on in their life that is really impacting the relationship they have with their body, maybe it's a way that a friend is talking to them or content that's being taught in class or something their parents are saying, and that's really negatively impacting the relationship they have with their body, they can use that ask skill cue to call it out, to assess what they need, to speak up, and to keep pushing so that they can protect themselves and to set themselves up in an environment that's going to ideally enrich the relationship they have with their body. Now, advocating can also happen in terms of advocating for others. And this can happen at different scales also. Maybe you're advocating for others within your peer group or within your classroom or your school or your community or going to the state, the state government or the federal government or these different things. There's all of these different levels of advocacy that can happen. And so again, though, to get to the point of being able to connect body image with advocacy, students benefit from a strong foundation of body image education. So this idea of advocating for others, students can take what they know about body image, what they know about body neutrality and about authentic health metrics in the body image continuum, and what it means to be at war or at peace with your body, and what they need to nurture an enriching relationship with their body. Then they can identify things that are happening outside of themselves that are negatively impacting other people's relationship that they have with their body image. Then they can begin to practice the skill of advocacy for advocating for health needs at this bigger, more community, societal level. Well, those are different teaching ideas for how you can teach body image using Shape America's health skills. If you want to teach skills-based health, I'm such a big advocate for taking a core health concept like body image and connecting it to all of the health skills and layering it together and really seeing how the skills work together to help you manage your own body image and manage the relationship that you have with your body or whatever other health issue you are wanting to address with students. So hopefully these health education teaching ideas have sparked something in you. Maybe there's something you want to take and use, or maybe something, gave you some inspiration and you have another idea. I'd love to hear from you. Drop it in the comments. What are you excited to integrate? What ideas do you have? How do you see us continuing to evolve as health teachers in terms of being able to teach truly authentic and impactful skills-based health education? And if you are looking for done-for-you body image teaching materials, check out Project Wellness's body image curriculum. It is grounded in body neutrality and really focused on that idea of helping students move to that at peace end of the body image continuum. So thank you so much for tuning in to not only this video, but to our whole body image series. And let me know what topics you want me to cover. Drop it in the comments or email me. Let me know, because here at Project Wellness, we are here to help make health education simple and to just be your go-to partner for all things related to health education.